Welcome to the Black Health Perspective, where we'll talk about our health from our perspective. I'm your host, Millicent Duncan.
And I'm your co-host, Brian Duncan.
Episode 2.
Number 2.
I want to thank everyone who watched our first episode, who bared through our flaws. I am ecstatic. I know we have like 200 views on YouTube. I did not anticipate that. I know it may seem small, but I'm going to take it as a big win.
That's a big one for the first podcast.
For the first podcast.
I think so.
So I am excited. You got to give or take 10 for what? Self-review.
Yeah, of course.
But we still got like 180 something views. Right.
Rookie podcasters. Huh?
Right. So we're winging it.
Yeah, we appreciate it though.
We do. We truly thank you, and hopefully we can give you more content that will lure you to come on in for the next episode.
Yeah, keep liking, keep sharing.
Keep liking, keep sharing. What is it? Like,
share.
What else I said, Warren?
Something like that.
Subscribe.
Like, share, and subscribe. That's it. Like, share, and subscribe. All right.
So let's go.
Okay.
What we're going to talk about today?
So this month is High Blood Pressure Awareness Month.
Okay.
So we certainly, from both our perspectives, have
a lot
experience in
insight
with regard to high blood pressure and the devastating effects that it has on individuals. Me, I see it more acutely, like when the symptoms first hit hard, and of course I deliver them to my wife as a care provider.
Well, I'm not in the ER anymore, so
even still though, we still have that same experience. So she sees it from that, where they're stable, sort of, but still unstable, and they need to be followed even further. So, got some good stories both in the hospital and before hospital.
I don't think they're good stories.
Yeah, maybe that's a poor choice of words.
Yes,
but
anyway, that's okay.
We have some stories that are relatable with regard to high blood
pressure. Because high blood pressure has affected us professionally and personally. Professionally, we have seen families come in that have been devastated just by not managing their high blood pressure. A lot of times I think, and I'm not blaming individuals because this is what's available to them, but the ER is kind of used as a Band-Aid to fix until the next episode. Right. And I mean, have you tried to schedule an appointment with your doctors lately?
Yeah,
it's tough. I mean, and I extremely feel sad for older individuals because everything is such technology based. Is in technology based, like maneuvering the phone system to connect them to make an appointment or go on a portal, and if they don't have family help to help them with that.
Gone are the days where you pick up the phone and call and somebody answered. Now it's, you got to pick the right extension, and then you got to leave a message or
fill out the paperwork on the portal. And everybody is just not tech savvy to mitigate through that whole process of connecting them to primary care.
Yeah, some parts of technology are great, other parts not so good.
Right.
So it's just kind of the state of the world today.
Right. So let's talk about professionally how I have seen families come through the ER. Like I said, it's a Band-Aid, and it's not because they choose to make it a Band-Aid, but it is the quickest and most efficient resource available to them. And if you have a family, if you have job obligations, and you need your income, especially with rising cost of housing, it's easy to say, oh, well, you need to follow up with your primary care doctor, or you need to establish primary care. But if you're not paying my rent, or if you're not paying my mortgage, or if you're not the individual who has to go to the grocery store with me and look at that final total, I can't tell you how easy it is for you to request or how much you can afford, if you can afford to take a day off from work.
That's when your health care gets put on the back burner because of other decisions that you deem a little more appropriate. A little more important. Then I went to the ER today because my pressure was up a little bit. I feel fine now.
Right.
So,
and I think we normalize some of the issues related to our health that's common in the Black community. High blood pressure and diabetes. It is almost as if it's normal for us that sometimes we don't apply the concerns necessary to maintain a healthy or make healthy choices to change.
Right.
Not everyone, I know for me, I kind of normalized the fact that one day I may have diabetes. It wasn't until I was older, saw some of the devastating effects of diabetes, and realized that I'm older and that, hey, this could be me, that I tried to make conscientious changes for myself and my family.
Yeah.
So what about a time that you saw pre-hospital?
So I've seen it more than once for sure. I find myself seeing people younger than me having hypertensive issues. I'm 53. I have high blood pressure, but I've seen trending more and more. I'm talking about people as young as early to mid 30s, and even up into their 40s, but certainly younger than me having issues. One call sticks out to mind. We got a call one day for an individual who was unresponsive. Get to the house, and it's a young male laying on the couch. He's not responsive. We can't wake him up. A little bit of history from his wife about complaints he recently had. Yeah, he's had a headache for a few days, and just didn't feel good today. Went down to take a nap, and we've been unable to wake him up. He does have a history of high blood pressure, but he hadn't been taking his medication. And I get this particular day, his pressure got so high that he had a stroke. That's where the leading symptoms were. He was unresponsive. I checked his blood pressure. His top number was well over 200. His bottom number was well over 150. And so all signs pointed to him having a pretty significant stroke. So we took him to the hospital. Unfortunately, he had a negative outcome. He passed away. 35 years old, only because primarily the likely cause because his blood pressure wasn't managed appropriately. He had the medicines, according to his wife. He just wasn't taking them. And that's not an all too uncommon thing. Taking your medications has to be a habit and a routine.
Does.
And if you're not in that habit, in that routine, you go a day, one morning you wake up, you forget to take it, and then it just keeps you forgetting to take it.
It spirals.
Exactly.
It spirals.
So,
and like, for instance, if you have, especially if you've gone to, I'll give this scenario. If you're in the ER and you've been given a prescription for a couple of months worth of blood pressure medication, and you are instructed to follow up with a primary care doctor or establish a primary care doctor. You've put off trying to make that appointment, either due to not having the time off from work, or you just may not have prioritized it. And then you take the medications that have been prescribed to you, but those prescriptions run out. And then that gap in care of you from you being seen in that emergency department and establishing that primary care doctor, and then you kind of like it just trickles to where,
away from you.
Yeah, it does. It gets away from you. And I'm not judgmental at all, because we all know how busy we are in lives. And some people be like, well, it has to be a concern to you at some time.
Well, not if it's not affecting you. If you're feeling fine, I'm gonna tell you this: the number one sign of people not doing this is that they feel fine.
Right, so, and that's the one thing about blood pressure that we must emphasize, is that it is a silent killer.
Oftentimes with no symptoms.
No symptoms
until it just compounds, and bam, you have that stroke. Now all of a sudden it's in the forefront, but it's almost too late then in some cases.
And as we spoke on the last podcast, the trickling or the damaging effects that the stroke has now affected you, your family, your financial outcomes for your family, everything is now on the table for you to face.
And you're behind the curve.
Right.
It's hard to catch up.
Right.
Yep.
So let's talk about what's defined as high blood pressure. Okay. So the American Heart Association looks at your blood pressure being below 120 over 80, your systolic 120 or below, and your diastolic 80. If we're going to say your top number is your systolic, so below 120 over 80. Let's focus on those numbers.
That's ideal.
That's ideal.
Yeah.
Then they begin to categorize elevated blood pressure is that top number starts getting between 120 and 129. Your bottom number is still staying below 80, but that top number is creeping up to 120, 129. Then you have stage 1, and stage 1 is considered that top number, the systolic, is between 130 and 139. But now that bottom number is starting to creep up, and that's between 80 and 89.
Right.
So, and then we have stage 2.
Yeah.
And stage 2 is anything above 140 over 90. So that top number above 140 and that bottom number above 90.
Right.
And I've had a few episodes lately of greater than 140 over 90, and I am on 2 blood pressure medications. I can sit back and see some of the primary causes to elevations in my blood pressure. Increased stress, workload. We took on some personal business ventures, that you have lack of sleep.
Yeah.
We'll sit up late at night, catching up on the show, thinking that we're still young, and get a couple of hours of sleep.
Man,
but we got
you realize how much extra sleep benefits you because you feel so much better the next day.
Right.
But those are some of the things.
That
we can recognize.
And in 2019, the CDC says over 500,000 people died from high blood pressure related issues. And I'm a numbers person, and we looked into what it costs economically for us as a country. And from they looked at 2003 to 2014, it averaged about $131 billion a year.
Yeah.
Now that's healthcare costs that it costs the healthcare system to manage a person who has high blood pressure and may not have adequate insurance or may not have insurance at all, or individuals who have adequate insurance, but their care is greater than what the insurance company will pay out.
Right.
But then there's also the cost to the individual. That individual who loss of income due to loss of work,
lost productivity.
Lost productivity, the cost of medications, and
that's a significant amount of money. Then probably a majority of it, a lot of it, could be prevented just by managing your blood pressure,
and bringing awareness of how important it is to manage.
Education is important as well.
Manage your blood pressure. Like, we have to not normalize it that it's common, but normalize it that it is something that you need to really be concerned about. Because there are some things, because 50% of all individuals who have high blood pressure are Black. Yeah. And that's why it concerns us so much, is because majority of the individuals who have high blood pressure, who have those poor outcomes that we see, look like us.
Yeah. And we see it all the time. All the time. I mean, like you said, the majority. I've seen, other cultures, other communities absolutely have high blood pressure. But the majority of the time, from my experience, most of the calls that I go to with devastating results from high blood pressure look like us.
Right. And the individuals that I see coming to the ER time and time again, who have those stroke symptoms, they just look like us. And I just want to get the awareness out that managing our high blood pressure is important. 1 in 3 adults, according to the CDC, has high blood pressure and does not even know that they have high blood pressure. So if 50% of the population is Black, have high blood pressure, and then 1 in 3, I mean, that's a lot of individuals.
So that's probably an underreported number for sure.
Right.
So the number at 50% is likely
a little higher.
And it's primarily because the symptoms, or there are none. until it's too late.
Yes.
Or you may feel A, B, C, D, and you just attribute it to a long work day, or you may have, you may be tired or fatigued, and there may be a virus going around. You blame it on that, or
Right.
you have headaches. Well, everybody gets headaches every now and then. They come and they go.
But I commonly say if I have a headache, oh, I haven't ate today. You
find yourself blaming it on
other things because you don't want to think about, or you don't want to place it under the category of your blood pressure may be a little elevated.
And that's when you get behind the 8 ball. That's when it manifests for so long and your body can only take it for so long.
Right.
And eventually it just gives out, and then you have a stroke, or you end up with some other issue like kidney disease.
So let's talk about that.
Yeah.
Let's talk about that. Let's talk about some things that are caused by high blood pressure. So you have, like you mentioned, you have stroke, you have cognitive decline. I have read some studies where they are linking high blood pressure more to cognitive decline, dementia-like related issues, vision loss, heart failure, heart attack. The top two causes of death are heart attack and stroke due to high blood pressure.
Right.
Then there's pregnancy-related complications, and that's something that, especially when we begin to talk about maternal health, when we talk about hypertension, that needs to be addressed.
Because that can be devastating.
That can be kidney dysfunction, and how many times have I seen them come into the ER and they're in full-blown kidney failure? My mom was a dialysis nurse for several years, and you see this young person come in and boom, it's like they've gone from going to work, feeling a little bad, to
now you're on dialysis.
3 times a week, and just the life-altering things. And then also it's called sexual dysfunction and peripheral artery disease. And I know some individuals talk about when they think about because sexual dysfunction is an important thing to discuss. They think that medications will cause them to have sexual dysfunction, but actually the lifestyle you have before then contributes to it.
Right.
So with that, nationally, like I say, we like to look at Healthy People 2030, and some things that are being done on a national spectrum in regards to healthcare, on goals that we are looking at through Healthy People 2030 to improve as it relates to high blood pressure. Okay. So, Healthy People 2030 is looking at decreasing the percent of adults over the age 18 who have high blood pressure. Currently, it is at baseline, but those are some of the goals that are out there, and looking at initiatives and evidence-based practice to encourage and reduce high blood pressure.
It looks like the baseline is about 30%, 29.5%.
They're targeting about to get it down to 27%.
That's the goal, right?
But it's currently at baseline still. So there's some work to do, but it lets you know that we are nationwide health individuals, healthcare providers are acknowledging that there are some important goals need to be addressed when it comes to addressing high blood pressure.
Right.
Okay. So, I guess let's talk about some things that lead to high blood pressure.
Well, plenty of them. Plenty of things.
Plenty of things that we need to do.
Yeah. One of the biggest things is, especially in our community, is an unhealthy diet. I think we can all relate to those, holiday meals. You have all the foods that are high in sodium.
But it's not just seasoning.
No, it's not just seasoning.
There's a lot of processed foods that we consume.
Yeah. Quick meals, fast food on a busy night, to feed your family or to feed yourself, things you don't really think about that are high in sodium, but that's one of the biggest things probably, and I mean, you know, we're not saying that you shouldn't have a big meal at a holiday, 4th of July, Christmas, those type of things. It's having those type of meals on a consistent basis, you know,
Right.
daily, 3, 4 times a week. You know,
Hmm.
you really don't realize.
But I wonder, is it the big meals that we're doing? I mean, because most of us, because so many of us are busy, I want, or is it the fast food?
Maybe it's probably
A combination
a
of.
combination of the two. But I think the big meals on the holidays is not so much. It's like if you're in a habit, if you're, you know, you're old school kind of, and you're having, you know, the greens and the macaroni and cheese, and you know,
You're not gonna talk about my greens.
the,
We're not gonna.
well, you know, they are good. Uh, but having them on a consistent
Consistent
basis,
basis,
every day,
right?
3 or 4 times a week, that's a lot of salt, you know.
But I just don't think that families have the opportunity to cook like that consistently during the week. That we, I think that for me, I believe that processed foods and
Yeah, without a doubt.
yes,
Without a
and
doubt.
fast foods
Canned
because
foods,
on
all
the
that stuff has sodium in it.
right,
You know,
on
but
the
it's
go,
easy. Yeah, it's easy to fix. It's a quick
quick.
30-minute meal. You know,
Mhm.
you just pop it on the stove, heat it up. But how many of us really look at a can of green beans and see what the sodium content is? So it's a lot of processed food. We buy it in the grocery stores. You know, they kind of steer you towards that stuff. And anytime you go out to, you know, a McDonald's or wherever, it's all processed, like you say, and it's, you know, it's
Mhm.
probably high in sodium content. So you're more likely to eat that on a consistent basis than the big meals. You're
Right.
right. I agree with you on that.
Right.
So
So it's not like I'm trying to say, oh, it's okay to have these big Southern meals. No, I'm not saying that. But I'm neither am I going to say a person needs to be denied
right,
occasionally.
sure,
I just there's a lot of contributing factors,
yeah,
and then
everything can be done in moderation.
it
You know,
can, and then
and then it's just choosing a healthy lifestyle, a healthy cooking lifestyle
right.
can
But
make a
then
big difference. If
I
you
also
know,
like to tie in environmental factors with that with unhealthy diet
mm,
because if you look at especially individuals who stay in low socioeconomic areas, they're not surrounded by Whole Foods. They're
right,
surrounded by those quick, high
mm,
processed food type
right,
of establishments,
mm,
you know. Um, and so it's not as if it is encouraged in the community as a whole
right,
to choose it's the options to choose healthy is just blaring in your face
yeah,
that
yeah.
it's not
And you make those easy decisions too. So
right.
easy in terms of what's convenient. You know, and that's
Right.
just always not the healthiest kind of decision you can make. So
Hmm.
diet is one of the biggest things.
Right.
Another thing is obesity
And inactivity.
and inactivity, which largely is a result of can be a part of result of an unhealthy diet.
Unhealthy diet and not
Yeah,
and
yeah,
inactivity leading to obesity. I mean,
mm,
we need to lose a few pounds,
sure,
you
absolutely.
know.
You know, but
Um
it's just so easy to come home after a long day at work. You just kind of want to chill out. You're not trying to go hit the gym or, you know, and you just want to relax.
and you need to I guess make those things a common practice
Yeah,
in your life.
yeah,
But it's hard and I guess I don't want to make it seem as I don't want to enable anybody, but I want other people to understand. We understand
yeah.
that it is hard,
It's hard.
to come home when you have maybe a child has football practice
Mm-hmm.
or they have homework or you have to go to work at night and you're
Yeah.
trying to get dressed and someone else is keeping your
Mm-hmm.
child. We incorporating these lifestyle changes in your life is not an easy task,
Right.
but it is something that we must encourage each
Yeah.
other to do,
Absolutely.
you know.
Yep.
Now there's another topic, too much alcohol.
Yep. Too much alcohol.
Oh,
And you know, you probably get a lot of discussion about that. I'm sure that's a popular subject, but it's recommended. It's recommended that women should have no more than 1 drink a day,
mm-hmm.
and for men should have no more than 2 drinks a day. You know, that's daily.
That's it.
That's
I
daily.
wonder, we were going to have a guest, but unfortunately, due to scheduling conflicts, we're going to hopefully have him on next week, or if not, eventually we'll have him on because at the end of the day, hypertension is in our community and it's something that we can discuss at any time.
Mhm.
But I guess I wonder one question: can I stockpile my drinks?
Yeah, I don't know that. I don't know that'd be a good idea. You know, to drink 1 day a week and take your 2 days for the 7 days and make it 14 days at once. That might have a detrimental effect on your health, too. So,
You were supposed to give me
yeah.
encouragement, but okay.
Yeah.
But anyway, and those factors we speak are controllable factors. So your diet,
Right.
inactivity, obesity, and alcohol are some controlling factors that you can take notice and focus on with delaying or stopping yourself from, I guess I might not be using the correct grammar or term, but something to help monitor, to make sure that you don't have high blood pressure, or avoid against having high blood pressure. But there are some uncontrollable factors.
Certainly.
So we're looking at genetics and family history.
Hard to escape that one.
It is, but then also when you look at family history, they're taking into consideration behaviors, lifestyle, environments, all those things that we just discussed in controllable factors. Like if your environment you're surrounded by large cookouts all the time, or fast food establishments, and there's not healthy choices for you to make, and then
you can still participate in all those things and still make healthy lifestyle choices,
right. But I'm just saying, when they say genetics and family history, I'm wondering how much of your family history is controllable and uncontrollable. And I guess I kind of deterred off the topic a little there. But age, generally as we all get older, we tend to have higher blood pressure reading. Sex, women, I guess it's equally proportionate to having high blood pressure as men, but men, on percentage wise, have high blood pressure more than women.
Right.
Now, do you think that is because men don't prioritize their health as much as women, or?
Yeah, I think men largely just kind of, like you say, don't prioritize their health as much as women. Women are more acutely aware of those type of health issues. They pay attention to it more. It's like your diet. You're more apt to pay attention to it and call me out when I'm not eating something well. Not to be any kind of way, but just to say, hey, maybe you shouldn't eat that, or men don't really pay attention to stuff like that. As a rule, I think. So I know for me, for some of the conditions that I have, I've had them addressed largely because of your input to them. Say, hey, you need to go get this checked out. Same thing with high blood pressure,
Right.
So yeah, I think just by the nature of men versus women are a little more acutely aware of those type of things and pay more attention to them than men do.
Right.
If they have good encouragement like I do, I'll pay attention to it, and I'm more apt to go get it checked out. But everybody's not in the same position that I'm in and has the same support that I have. So it's up to us to try to get this kind of information into your mind and hopefully have you pay attention to it and follow up a little bit better than you might ordinarily do.
Right. And race, we've already discussed that for Black people, we are more prone to have high blood pressure than any other race.
That's right.
But there are things that we can do.
Absolutely.
There are things that we can do. I think with everything that we're getting ready to name, of that we've already really named of what we can do, I think one thing that I want to stress is, and I know sometimes it can seem difficult, is that we need to include our children.
Yes.
If you have children, we need to include our children, because you have to include them, because they won't know how to change their habits unless it's taught to them.
Right. Children are learners,
Yeah,
they follow what they're taught.
Right.
In many aspects, especially with nutrition.
Right.
Kids don't pay attention to that.
Right.
You make food and they eat it.
Right.
And that's what they know. So if you make healthy food choices, they'll follow along that. And then along the way you teach them,
yes,
watch out for this or watch out for that.
Especially when you're trying to teach them about your family. Children need to be aware of what your family history is, and not just in like a passing conversation, because I don't think, for me, I knew I had a family history of diabetes and high blood pressure, but I don't know. I guess so okay. Well, then let's talk about some things that we can do to help individuals prevent high blood pressure.
Okay.
So getting at least 150 minutes of exercise a week. So that breaks down to about 30 minutes of exercise per day.
Yep.
No smoking or actively engage in some type of smoking cessation program or smoking cessation. Eating a healthy diet. Um, this includes limiting your sodium intake. I think, like I said, I think a lot of people relate their high blood pressure with what they shake on their food,
Right,
what they
yeah.
season their food with,
Yeah.
and it's just that we are such a processed society that I do think there's some education on label reading that needs to begin, and hopefully someday we can have a dietitian on who will probably go in and just tear our pantry apart.
Probably
But
so, yeah.
alcohol, like we said, although we're not heavy drinkers, we drink socially like anybody, but they want you to limit it to one or two drinks per day.
I think they call it drinking in moderation.
Yes.
Yeah,
Keeping a healthy weight. And I know for me as a woman, as I get older, it is like sometimes you feel as if with all your intended efforts, the weight just comes,
on, yeah.
and stress, just all of that contributes to.
It does.
Yeah.
It does.
And then, like I said, the last one is managing stress.
Yeah.
And I can only imagine how stressful how stressed individuals were during the pandemic. Loss of income for some, just the fear of trying to do their best not to contract this, horrible virus, or
having to deal with family members who do get it, and
right,
if they have a poor outcome,
loss of family. So it's just been stressful, and so I know that some individuals probably are having to do a reset after this pandemic. But then we need to talk about for individuals who do have high blood pressure, it's not a death sentence. It can be managed.
Absolutely.
It can be managed, and there are a few things that you can do individually, that you can have expectations or ask questions of your primary care doctor. Individually, what you can do is know your numbers. Monitor your blood pressure. Keep a log.
Absolutely. Check it every day.
Check it every day,
they recommend you check it twice a day.
Yes.
First thing in the morning, and at night before you go to bed.
If you don't have a blood pressure machine at home, you can stop by I can't say stop by your primary care office because getting in may be difficult. But even the fire station, fire department can go by and see about checking your blood pressures. But especially keeping that log to know your numbers. If you can afford a at-home blood pressure machine, there are several that the CDC recommends that you can use to monitor your high blood pressure. Try to change your diet and limiting your sodium intake. They do recommend between below 2,000 milligrams of sodium per day, more or less staying on the healthy grains, fruits, and vegetables. Staying away from your fatty foods and processed foods and high sodium seasonings. And those things, it may seem like, I think one of the things that I hear, and I used to say it myself, was, hey, we all got to go sometime. And that's true. We all got to go. God's calling us all at some point. But me and you have seen a lot of people leave here and leave a lot sooner than they should have.
I want to stick around for a while myself.
And not to and sometimes, it's so sad to see the condition that some people leave in. I don't want to leave like that. And I mean, yes, a car accident you can't help. Like a car accident you can't help. A traumatic event, those aren't
something that's manageable, like high blood pressure.
But if
you can prolong your life,
and just to see some of the outcomes that we have seen individuals due to a stroke, or due to a heart attack,
which is primarily caused by
high blood pressure.
You just
that I don't. For me, we have seen some very devastating effects from unmanaged high blood pressure. And then, so what did we, oh, let's talk about medicine. So if you are on medication for high blood pressure,
Yeah.
right? Um, you have to develop that routine and stay consistent.
Pay attention to how you feel when you take your medicine
Right.
too, because some of the side effects can be telling in terms of what medication is most appropriate for you to take. Yes.
Mm-hmm.
So like for me, I was taking a blood pressure medication, and it was making me feel really fatigued and tired all the time.
Mm-hmm.
So I paid attention to that, and I spoke to my provider about that, and we made an adjustment. And
Right.
I've been fine with my medication ever since.
Right. Some people will take their medication. Oh, it doesn't make me feel right, and just stop taking it.
Right.
Don't do that.
No.
Don't do that.
That's defeating the
Yeah,
whole purpose.
that is. Have that talk with see if you can be placed on something else, or maybe take it at night.
Right.
But don't just stop altogether. If you are having great numbers from taking your high blood pressure medicine, don't stop. That doesn't mean that your high blood pressure has been cured. Don't stop.
There's no cure for it.
There is,
I mean,
it's just, not saying that that you're right. There's no cure for it. Like, there are some individuals who can lose weight, change their diet, and their physician, they can have that that conversation with their primary care doctor and ease them off that medication. But don't just, I feel better, my numbers look great, and just stop.
Yeah.
Don't
certainly
stop.
Without talking to your doctor about
Right.
it,
And another thing is, I do how can I say this?
Just say it, baby. Say it.
Like, all myths don't mean they're gonna cure high blood pressure. Like, what are some myths that you heard? Like we went over it.
Yeah.
If I take my medicine
and my numbers get
Get
better,
better.
then I don't need it anymore.
vinegar is not a
It's
not a go to, go all be all.
Right. The one big thing is that I feel fine.
I feel fine.
And like we've talked about before, high blood pressure is a silent killer. So
Mhm.
just because you feel fine today doesn't mean that you don't have something that needs to be addressed. That's probably the biggest one.
Right.
Is that I feel fine.
And then, another thing that may be a touchy subject to some, we are a very faith-based community, which is great.
Yeah.
But sometimes I do think we may take out of context when we say, I'll leave it in God's hands.
Yeah.
Because I'm a firm believer that God has given us knowledge and discernment to make, I don't believe He'll allow us to know anything He doesn't want us to know. And I don't want to,
Sure.
go off on a tangent about faith, but you can't, how do you say, faith without works? Sometimes you have to put in that work.
Right.
So if you don't want to be on that medication, then let's get
Put
out
in the
there and
work.
walk together.
Exactly.
Let's get out there and change our diet. Let's get out there and lose the weight that we need to, me included. You know.
Yep.
So those are some things, and then there's things that we can ask for, that we can, like I said, keep a blood pressure log. We talk about that.
Yep.
Also, when we address social determinants of health, you do have to look at some things as far as your environment, accessibility, the community you live in, as far as accessibility to healthcare, accessibility to the good eating and resources in your community. Like, there are some communities that have, what are they called? When you go pick your fresh vegetables, like a
farmer's market.
like a farm.
Farmer's
I
market.
don't know why I slipped my mind.
Yeah.
But yeah, like a farmer's market, where the option of choosing fresh fruits and vegetables is readily accessible, but it may not be accessible to all communities.
There's factors like just an inability to get to a farmer's market.
Right.
Transportation.
Individuals during this time may be managing stress completely different, we're in our sunroom, but individuals who may be managing stress completely different at this time frame. Like, you have escalating housing costs And if an individual's um, hourly wage has not increased, but yet
Living expenses.
their
have.
living expenses, when you're thinking about gas, food, housing costs, and if you have children,
Yeah.
the affordability that may take precedence over medication or
Right.
taking a day off from
We
work
hear that a lot.
to
People
go
choosing this
right
over their medicines.
over that.
Gas over their medicine.
Right.
You got to have gas to get your medicine, but the gas costs are so high, you can't afford the medicine.
But
So I mean, it's
right.
just
And
compounds, and forces you to make tough decisions.
right. And when I was when I was in my nurse practitioner program and I was doing my clinicals, I consciously chose locations that dealt with indigent population because one, I had worked in the ER for such a long time, and I enjoyed working in those types of populations because I know even before me and you were together, what it was like being as a single mom and having to make those, I didn't have health concerns at that time, but having to make those decisions, you know? So let's talk about some call to action things that nationwide, that the Surgeon General, I found this interesting because nationally, our individuals are recognizing that this is not a health crisis, but something needs to be done.
Yeah.
And there are some goals that they have set forth to make controlling hypertension a national priority.
Yeah.
Right?
Yeah.
So we have to discuss awareness, the economic burdens, and also the disparities, which we've just talked. We've touched on several of those just
but it's
a few minutes
on
ago.
a national level.
Right. It has to be on the national, which I think it is being brought to the forefront because you can't ignore it.
Right.
Right. Then goal 2 is to ensure that the places where people live, work, and play support the control of their hypertension. So that means promoting physical activity in the schools, promoting healthy food opportunities like we spoke about the farmers market, and also encouraging those lifestyle changes. I don't know if it's through marketing campaigns or just
public service announcements.
But nationally we are recognizing that something has to be done to prioritize controlling high blood pressure. And then the last one here is optimize patient care for hypertension. There is a standardized treatment, and that's a treatment option that you need to discuss with your primary care doctor. Now, I think that ideal patient is that individual who has health insurance, has an established primary care doctor, can make that appointment, go in and have that conversation. But there are so many out there who are inadequately covered for health insurance or don't have insurance at all, who rely on community clinics, and they are out there. Just knowing where and the process of reaching them, and also those individuals who may not even go to a community clinic, who go to the ER, understanding them. Those are not ideal patients that we need to target.
Right. Yeah. The resources are not equally available, and that's a tough thing.
It is.
That's probably one of the biggest thing, if not the biggest thing, the disparity in terms of healthcare access. With so many different things, not just high blood pressure, but just so many different things. That inequality it makes a lot of life difficult. So that's a target, and hopefully we can get to a point where it is a priority. And then we can just be better aware of it and provide better resources and kind of just get people aware this type of issue isn't as devastating. We can kind of, I don't know how to say it correctly, but we just want to make it manageable as best we can. We can certainly
Right.
increase, better increase or decrease the statistics of young folks getting over here, young folks getting hypertension.
That's bothering.
So our goal is to just
Just bring awareness.
Yeah.
So, I guess a recap would be, hey, let's get out there. Let's know your numbers.
Mhm.
If you have high blood pressure, know your numbers. Keep a log. Take your
Don't-
medications.
Don't ignore the subtle symptoms.
Yeah, but like you say, some people may not have symptoms at all.
That's true.
But if you can beforehand, if you don't have high blood pressure and you have a family history of high blood pressure, you can change your diet.
Yeah.
You can exercise. You can
Minimize your alcohol intake.
minimize your alcohol intake,
Relieve your stress.
relieve your stress
In a healthy way.
in a healthy way.
Yeah, sure.
If you do have high blood pressure, take your medicine.
Absolutely take your medicine.
Keep a log, and if you're having issues with that medicine, don't stop. Talk to your provider to see what type of alternate choices are available.
Right.
I think that's a good bit where we can.
Yep.
Yeah.
We could talk about this forever.
Forever. Really, we
all
can.
Day, every day.
Yes.
So-
And like I said, initially we had a guest to come on, which hopefully we can get it rescheduled and get them back on within quickly.
Mhm.
Because high blood pressure is here. So
Yeah,
it's not
it's
as
not going
if
anywhere.
it's not going anywhere. So what's the saying, Warren? Like, subscribe, and share.
There you go.
But again, we want to thank you for tuning in to the Black Health Perspective, where our health from our perspective. Thank you.
Thank you.